how it led you to become the Chief Pharmacy Officer at the Community Health Northwest Florida. What motivations at the first place that motivated you to pursue a career in the pharmacy?
So I think what motivated me the most to pursue a career in pharmacy was helping others, being able to help others. Um, I grew up in a small town where there were a couple of independent pharmacies, and being able to work in those independent pharmacies gave me a great insight to what pharmacists can do for the community and how they can be very helpful to the community. So I think that's what motivated me most to pursue the career in pharmacy.
Yeah, interesting. Thank you so much. So then, can you please, like walk us through the professional journey and the ups and downs and all the different steps that you've come through to become where you are at the current as the current Chief Pharmacy Officer at Community Health Northwest Florida?
Yes, sure. So I went to pharmacy school at Auburn University in Auburn, Alabama. I went on to get my doctorate of pharmacy from the University of Florida in Gainesville. After that, I came to Pensacola and I worked a small amount of time in hospital, working at the Women and Children's Hospital. From there, I joined some of the large chain pharmacies, and I worked in a couple of the chain pharmacies for a while. From there, I was hired to manage an independent pharmacy here in the Pensacola area, and I managed that pharmacy for the previous owner for several years, about 5 or so years, and he was ready to retire. So from then, I purchased the pharmacies from him. At that time, we had two independent pharmacies in the Pensacola area. I grew those pharmacies to four. We had four pharmacies in the Pensacola, greater Pensacola area. And after having those, and it's very rewarding, I wanted to slow down and take some time. And so I sold two of my pharmacies to Community Health Northwest Florida. We had been working with Community Health Northwest Florida for several years on helping their patients in the community, and also helping them start up their 340B program, which is a wonderful program that helps those uninsured and underinsured individuals in our community. So part of Community Health Northwest Florida purchasing two of my stores was that I would come on board as their chief pharmacy officer for a couple of years and get things started and make sure everything's running well for the clinics before I retired. But I have enjoyed my time here at Community Health Northwest Florida, so I'm going on my 6th year here at Community Health as their chief pharmacy officer.
I see. Yes. So can you please provide us with an overview of the mission and as well as the vision of Community Health Northwest Florida?
Oh, I'd be glad to. The mission of Community Health Northwest Florida is to basically help all individuals, all patients who walk through our doors, no matter of their race, religion, background, ability to pay, whatever circumstance they're in. We want to be able to help those individuals in our community to live a more happier and more productive and healthier life. Because we believe that citizens in our community, if they are healthy, they are happier and more productive in our community as a whole. So, part of what we do is just that. That is our mission, to help our community be healthier and more productive citizens. But in doing so, all communities have a certain number of patients that are underinsured. That means they may have an insurance card in their pocket, but they have high deductibles and they just can't pay those deductibles when they go see the doctor or go into the pharmacy to get their prescriptions filled. Or we have individuals that have no insurance at all. What we do is help those individuals. We help everyone in our community, whether you have insurance or not. But we want to keep those individuals that have high deductibles or have no insurance at all healthy and keep them out of the emergency room. Because we know as a community, if a patient has to go to the emergency room for just a minor illness, or what we call an acute problem, maybe an ear infection, a sinusitis, or maybe it's just a little hypertension problem, that costs our community a great deal of money. And so if we can get them into primary care here, making sure we do good primary care and preventative care, and making sure that they have the ability to get the medications that they need. You know, it's one thing to diagnose someone and say, okay, well, you have hypertension or you have diabetes. If they don't have the ability to get the medication and to take that medication appropriately and, you know, consistently be adherent to it, well, we haven't really done anything, you know. So we're trying to put everything together for our citizens to make it a whole package for them to be able to see the primary care physician, get into preventative care, get the medication they need, and be adherent to that medication.
Yes, understood. Thank you so much. So when it comes to the U.S., healthcare system, it is usually associated with a very complex reimbursement system, where drug pricing involves transactions from multiple parties, which kind of leads to a principal agent problems where patients are, where there is a potential misalignments between of interest between different parties. So in this case, how do you ensure, or how does your organization ensure that the patients' needs are being met, especially for the uninsured and underinsured patients?
So that's a great question, and you're right. Healthcare in the United States is very complicated. It has very numerous layers that you have to kind of unfold to understand that system. And so, what we try to do is one philosophy: put the patient at the center of everything we do. If we put the patient at the center and we talk to that patient, educate that patient, make them part of their healthcare needs. See, then everything revolves around them. We kind of take that layer and make it very simple. We take the layer of, of your medical insurance and don't worry about it. We're going to take care of that. We take those layers of the problems with getting your prescriptions filled, whether it was be with the PBMs or the insurance company itself or prior authorizations. We try to take all of that layering away and focus just on what the patient needs. And with that comprehensive approach that we take, whether it's with the primary care or women's care or pediatrics, we have our lab, we have x-ray, mammogram, we have pharmacy. It allows us to just put the patient at the center of everything we do and help that patient walk through all of those processes.
I see. Yeah. So a very customer and patient-centric approach
Yes,
that the company is taking. Got it.
yes.
Yeah. So here, I would like to understand more about your current role as the Chief Pharmacy Officer. So can you please share with our audiences some key aspects of your role in overseeing the pharmacy operations at Community Health Northwest Florida?
Sure. You know, here at Community Health Northwest Florida, my role as Chief Pharmacy Officer, I wear a lot of hats. It's not just pharmacy. Pharmacy is kind of my expertise, but I kind of overlook the whole process of our clinics and our operations and the needs of both the patient, the provider, and all of our employees. But what I'm really essentially in charge of is our 4 in-house pharmacies, all of those personnel that are associated with those. We have an ambulatory care pharmacist, a clinical pharmacist. I am in charge of her. I am in charge of our PY1 pharmacy residency program. We have a residency program that's ongoing, and I'm in charge of that. I'm in charge of the 340B program, which is an essential program for us as a federal qualified health center to help those uninsured and underinsured individuals, whether it's helping them pay for their copays or their medications, or expanding services that we need in our community. An example of that would be our funding and our savings that we get from that 340B program is used to help with mental health services in our community. So as you see, the kind of just putting it in the hat of pharmacy, it kind of is broadened throughout all avenues of our health system and our clinics.
Right. Awesome. So, in your opinion, what are the most significant challenges you faced in pharmacy leadership and how have you tackled them?
So I think right now I'll say there's been numerous over the 30 years that I've been practicing pharmacy, but I'll focus on two. I think the pharmacy benefit managers have in the world of pharmacy have too much control. There are about 3 big pharmacy benefit managers that control upwards to 80-something% of all prescriptions that are filled in the United States. I think there's a problem there. I think the vertical integration of healthcare systems, whether it's insurance companies owning PBMs, owning
Mm,
their own pharmacies, owning their own mail order pharmacies, that doesn't open up choices to the patient. And so I think that causes price increases. I think that causes a reduced amount of choice to the patient, and it makes it more complicated. So I say the pharmacy benefit managers, I think that whole industry needs to be unraveled and cleaned up, because I think it increases prices in America. The other thing that I think that is a large issue that I'm looking at now is the attack on the 340B program. You know, the 340B program in the United States was put in place by the first President Bush under the Veterans Administration Act. And it basically said, you know, we know that there's increasing prices. And as the federal government, we're not going to be able to keep up with those increasing prices to help keep people out of the hospital and out of the emergency room and keep up with this high cost of healthcare. So what they did is they put together the 340B program, and it allowed the manufacturers, the drug manufacturers, to be part of this and say, okay, if you're going to be part of the federal Medicaid program and the federal Medicare program and the programs with the Department of Defense and all of those, you have to be part of the 340B program. So what it done, and it allowed us, like covered entities like us, federal qualified health centers, because we help a large percentage of uninsured patients, to take advantage of that. So it allows us to buy our medications, the medications we use inside the clinic when we give to the patient when they're inside the clinic, or the medications that we dispense in our pharmacy at a much lower price, and
mm,
extend those savings on to those people who do not, are the patients that don't have insurance, but also allows us to grab savings from the insured patients and use those savings to help uninsured patients and to provide more services. 340B program has helped us to put an optometry department in, and has done a great job of helping both the young students going through school. It's amazing to see young people who get new glasses. And then I was sitting in that department the other day, and it was just so fun seeing someone have their new glasses on for the first time. And then the mental health component of helping people in our community with problems with mental health and getting over those hurdles. So the 340B program, unfortunately, right now for the last 3 to 4 years has been under attack. It's a political pawn, and some of the manufacturers have tried to pull out of it. So it's been very difficult for us to continue our operations when there's reduced savings in that department. So those are the 2 avenues that I'm looking at right now as things that I have to keep focused and look sharply at
mm.
as I go through our services.
I see. Yes, I do echo your concerns regarding the pharmacy pricing, especially pharmacy. They charge an inflated pricing based on the usual and customary retail listed price. And based on a survey, based on research, we see that compared to other 32 other countries, U.S. drug price are significantly higher with more than 100% markup. So this is how, like companies like GoodRx are um, benefits from getting a cut of the
Mm,
price BBMs negotiated for them, and how they can be profitable by that. So it's very insightful that you share about that one, and on also the program 340B as well. So based on that premise, can you please share some innovative strategies and initiatives that you have implemented to enhance the pharmacy services and patient care during the tenure at Community Health Northwest Florida? Because as you might be very aware, healthcare services and healthcare delivery at the end of the day still make up a high proportion in the total healthcare pie for the patient journey. Yeah.
Yeah. So we have to take a more strategic look at the care. But now remember when I said we have to put the patient at the center of everything we do. That's important. We can't lose focus on that. And keeping the patient at the center of what we do. And when I'll talk about the drug therapy, yes, those high prices of medications. And when we have things like the increased pricing of medications, and then we have on the other hand, the manufacturers not wanting to extend savings on the 340B program. Because of those type of things, we have to have a strategic focus on how do we help that patient uh, get good care and be adherent to their medication, right? So what we have to do is put things in place like a formulary. So instead of
Mm,
having an open formulary where, say everything is on the books, we have a more of a stricter formulary. We have to limit the formulary. So I'll give you an example of saying having 20 hypertension type products. Maybe we lower that to about 10 to where we can better, purchase those products at a lower price and extend that savings
mm,
on to the patient. Because we know that you can't get better. You can't control your hypertension or your diabetes if you don't take the medication, right? So we have to
yeah,
make that medication affordable. So what we do is we do things like we do a formulary management. So in formulary management, we look at the most cost-effective product. We look at products that have the least amount of side effects. We look at products that can both be used for like hypertension or protect kidney function and things like that. So we have a team that looks with us. A multidisciplinary team that looks and says, how can we hold our formulary tight for those cost savings? Other avenues that we put our pharmacists in with the teams with the physicians. And they are doing rounding and seeing the patient because drug therapy is important. We look and say, to the patient, let's make sure we know all the medications you're on, including the over-the-counter products, because there's interactions with those over-the-counter products with some medications. So we want to cost effectively, but effectively look at the whole picture of what the medication they're on. And when we discuss with the provider, okay, well, you thought maybe this product, but this one seems to work a little bit better. And as the pharmacist and the physician and the provider collaborate, the outcomes become better for the patient. So it is a team approach, keeping the patient still at the center of everything we do, looking at how we can save cost and overall save for the overall healthcare uh, in our community with great outcomes. So your question is, what are we doing? We're putting pharmacists on the healthcare teams. We're looking at formulary issues to more cost effectively purchase those products and get them in the hands of the patient. And how can they be more adherent with those type things? So we
I
know that
see.
if you have side effects on medication, you don't tend to take them, and so we want to make sure that we have that two-way communication from the patient to the provider and the pharmacist, that everything is working appropriately.
I see. Yeah. So basically, what you're doing is tackling, like providing healthcare from the very upstream, from the manufacturer to the wholesaler, pharmacy, and to the patients itself. So, am I correct? Am I understanding, like the value propositions of the company correctly? Or is there any focus or the segments that you're more focused on?
Well, we focus more on taking care of the patient as a whole. Part of
Right.
the job that I have to do in the background is looking at that, looking at the most cost effective way. And how do I do that? I look at the manufacturer, I look at the distribution models, I look at the end price as it comes into the pharmacy, and how much that's going to cost the patient uh, to obtain the medication. And let's say chronic medications. You know, a patient could pay $50 for a month's supply at one time, but that becomes cost prohibitive over the lifetime of the medication. So like a blood pressure medication, they could pay it one time, but they can't pay it every month for years.
Right.
So we have to look at that. How do we make these chronic medications affordable to the patient? for over the long haul for positive
Right.
outcomes. Mhm.
I see. So, in that sense, how do you ensure the delivery of high quality pharmaceutical care to the patients served by the organization? Are you also participating in the health plan for the patient itself in designing the payment system for them to obtaining the drugs?
Well, yeah. So I'll give you an example. If you have a uninsured or underinsured patient, we don't have insurance to battle that, but we have to make it still affordable for the patient uh, uh, to take time and time, month after month, for adherence. So we have to make it affordable. Not only affordable, but with the least amount of side effects, with the biggest outcomes. So if so we have to look at that for those are uninsured. So those who are insured, we look at that. So if you're insured, you go and give the pharmacy your insurance card, but there's many different layers of copays. There may be a
Yeah.
$5 copay, it may be a $25 copay, it may be a $50 copay for that medication. So if you have a patient that has some financial difficulties, they may have an insurance card in their pocket, but when they go to the pharmacy, that copay is $50 or $100, and that's not affordable for them. So we have a plan, what is called our sliding scale plan, that we can take that $100 copay and we can slide it down to an affordable amount, say $10 for that patient, and they can afford $10 monthly. So that now that $100 copay becomes $10 and it becomes affordable. And you say, Darrell, how did you do that? Because we're a federal qualified health center, and because of the savings I have on 340B, see, I can bring that copay down to affordable amount. And but it depends on the patient's income. You have to fall at a certain income level. It's called the federal poverty level, and those different percentages of how someone falls, and that's how you get on a certain level of the slide. So the point is keeping the patient at the center of everything we do, and trying to keep the patient healthy and out of the emergency rooms and hospitals. Doing so, I can make that medication affordable for them. Another thing would be, okay, well, that's a high copay medication for you, and our pharmacists evaluate that, look at the things that the patient has had in the past, look at the health record, and say, okay, instead of using drug A, which has a $100 copay, why don't we call the physician or the provider and say, drug B may be a better option with a lower copay. So it's the same class of drug, probably works just as well with a patient. So we do those type of interchanges. That's called a therapeutic interchange. And so we have our pharmacy team that are actively looking at that to help the patient, making it more affordable.
I
Does that
see.
make
Yeah.
sense? Mhm.
Yes, definitely. Yes, thank you so much for that. So here, to better exemplify the impacts that you've created to both the underinsured and uninsured population, can you please share with us some successful stories or impactful initiatives undertaken by the Community Health Northwest Florida in providing comprehensive healthcare services to the community and
Mhm.
also its outcome as well? Yeah.
Yeah. So I'll just tell you a small story thing that I had. When I owned my own stores, um, I love patients. I love the community. I love talking with people and interacting with them and helping them with their drug therapy. The hardest thing with owning your own store is when someone can't afford their medication. That's the hardest thing that any pharmacist has to go through. And owning your own pharmacy, you can bring it to your actual cost. You can even below cost, but you can't do that forever, because you have to pay your employees, you have to keep the lights on, you have to pay the rent, you have to pay your wholesale bills. So was a very difficult thing. And then when I joined Community Health Northwest Florida, when I joined the team as a federal qualified health center, when those patients come to our pharmacies and they can't afford the medication, we make it happen. We make it happen because of things like the 340B program, because of the clinical pharmacy interactions we have with the providers. No patient should leave our pharmacy without medication. And that to me is so rewarding in what I do today. What are those outcomes? We have reduced emergency room visits. We have reduced hospitalizations. So I'll give you an example. A patient that is a diabetic patient that can't take their insulin. Over time, their blood sugar rises. They could go into to what we call DKA. That visit to the emergency room will get you into the hospital. You have to stay, probably a week-long stay in the hospital with that. That cost to our community and to the taxpayer is upwards to $200,000. And what we could have, what we do is we get that patient their insulin. We make sure they're taking it appropriately. We're making sure they don't have side effects. And when we get that patient their insulin and they're taking it appropriately, guess what? We have a $200,000 savings because that patient will not have to visit the emergency room with that type of problem. So as you see, if you extrapolate that across the community, and diabetes and hypertension are some of the biggest disease states that we have in the United States, just extrapolate those costs in the savings to communities and taxpayers in our community here in Northwest Florida, but all over the United States. See, we have a broken system, and today we can't fix it today. Hopefully, we've got plans to do that. But today, I can save the taxpayer and our community dollars by helping those who can't afford their medications, keeping them out of that emergency room and hospital. So there's where we see the rewards. We, you know, we see it in our school. We have pediatrics and a pediatric clinic embedded in two of our elementary schools. And we see that when we keep those students healthier and they're able to attend class more, they learn better. Their graduation rates are up. They go on to the universities and they come back, hopefully, to our community to be productive citizens. So it's not something that we see as an immediate return on our investment, but we see it in the long run. Does that make sense?
Yes, definitely. Yeah, so making medication more affordable to the population, as well as paying it forward to the next generation of pediatrics, and focusing more on education as
Right.
a power. Yeah, okay, right. So yeah, let's turn the floor and like to a more to some more questions regarding your leadership abilities and also your experiencing as a leader. Our audience here are very interested in learning more about your what are you thinking about the what do you believe are the most important qualities or characteristics of a successful leader in healthcare, particularly in your field as a pharmacy manager?
Oh, I think that's a great question. Great leadership is so important. There's a quote, and I think it was a John Maxwell quote that said, "Everything rises and falls on leadership." Everything, and that's true. We all, in a sense, are some type of leader, and so I think one of the most important things for leaders to do is to connect to people, and in connecting with them is understanding where they are. And what I've always said to my students and to my pharmacists, meet the patient where they are. As leaders, that's what we have to do with our colleagues and our other employees, is meet them where they are. And the most important, I think, thing that leaders can do in meeting your employees and your team is listen, actively listening. I think it's hard for some people to do that, and we have to understand that actively listening is being there in the moment. It's stopping what you're doing, not making the notes, but listening to the concerns of your team members. And when you listen to those concerns and you take it in, most of the time your team members are going to give you great ideas on problems within the system that we create, great ideas on how to make the system better. And when you do that, guess what? Productivity goes up, involvement goes up, and then you have a more active, involved team. And team employees and team members want to be involved. You know that? It's not all about the money that they're making, it's how engaged they are in the process. And I think that's so important. Leadership is key. We have to have leaders. And I think all of us have some type of leadership ability within us. We just have to pull it out. But I think the most important thing that I can say in leadership is be engaged, be there, but actively listening is so important.
Yes, definitely. Thank you so much for the sharing. So, how does that align with the overall mission of Community Health Northwest Florida, in your opinion?
So I think that in our team, in our department, in our division in pharmacy, when we have these leaders that are know how to be engaged, how to actively listen. So what does that how does that what is the downstream effect of that? Let me give you an example of the downstream effect of that. We were in a meeting the other day where one of my pharmacists was telling me that a patient came in and wanted to talk to the pharmacist and meet with them. And they did not understand. They said, I have this insulin pen and I'm using it, but my blood sugars aren't going down. And so the pharmacist said, well, let's sit here. Come tell me how you're working it. How's it going? Show me the process and all of that. So the actively listening, having that communication, meeting the patient where they are, down at the level of where they are, of having to see what is the problem and how can we correct it. We found out that the patient was inappropriately dialing up the insulin pen and therefore wasn't really getting the insulin that they needed. So finding that out, see, being involved not only comes from the top as the leader or the boss, but all the way down. And see, I think it just is a ripple effect when we look at those type of process. And as leaders, we engage our team and we train our team and we mold our team into being those type of the type of people. Outcomes, productivity, everything falls into place, right? So, I have when I'm a lot of times I say in my meetings, don't work about the profit margins. Focus on the patient. If we focus on the patient, productivity and profit margins will fall into place. And it has. So I think as leaders, you have to, every step that you take, every move that you make is a ripple effect to your whole team. And I think that I see that with our clinic as a whole in being able to be a patient-centered clinic, putting the patient at the center of everything we do.
Interesting. That's super insightful. So, as a final note, are there any message would you like to convey to our fellow healthcare professionals and aspiring leaders in this field?
I say stay involved. It is not easy. Um, but stay involved, stay focused, keep the patient at the center of everything you do, um, and everything else will fall into place.
Right. Stay involved, stay focused. Right.
Yes.
Thank you so much. I think that already wraps up our interview today. That's super efficient and super insightful. I think I've went through all the question list in our IQ today. Thank you so much, Darrell, for your insightful sharing and also taking the time for joining the interview with me today. Very happy to meet with you. So our team will circulate the first draft for your reviews. In the meantime, if there is any concerns or any things that you would like us to give more feedback on, please feel free to reach out to our team.
Oh, wonderful. It was so nice meeting you this morning and having a chat with you. I enjoyed it.
Yes, me
Thank you
too.
so
Thank
much.
you. Have a
Bye bye.
great day.
You
Bye.
too. Bye bye.
Bye.